Hi, my name is Jonathan Finoff, and I'm going to be demonstrating a live ultrasound examination of the anterior elbow. I don't have any disclosures, but I do have a disclaimer. This presentation is not meant to be a comprehensive review of this topic. Our objective is to cover the core competencies as outlined in the AMSSM recommended sports ultrasound curriculum for sports medicine fellowships. All right, so we're going to go ahead and scan the anterior elbow. So the first thing I want to do is make sure that I have adequate depth. That the focal zone is lined up with the structure of interest, and then I want to orient myself. So in this picture, on the top of the screen up in this area here is going to be the biceps muscle. Down here is going to be the brachialis muscle, and this is going to be the intermuscular septum. And so frequently as I'm scanning distally, you can see the musculocutaneous nerve. As you can see right here, there's the musculocutaneous nerve as I go back and forth in that intermuscular septum. So as I'm coming down to look at the anterior elbow, what will happen is the biceps tendon becomes more and more prominent with less and less biceps muscle. And you're going to see more and more of the brachialis. Now I'm readjusting the depth, I'm changing my focal zone. These are constantly going to be readjusted throughout the entire scan in order to make sure that you're optimizing your image. So as I come down here a little bit distal, this is one of my main spots, sort of a home base where I like to start the scan. So in this particular picture, right here is the capitellum, and right over here is the trochlea. On top of it, you can see this anechoic structure. This is hyaline cartilage sitting on the intra-articular portion of the distal humerus. Sitting on top of the trochlea and capitellum is going to be a big muscle right here. That is your brachialis. So this entire thing right here is your brachialis. And right in the middle of the brachialis right here, this hyperechoic portion, that's the brachialis tendon. Sitting on top of it up here is going to be your biceps tendon. And if I move more radial, you'll see the radial nerve. And just radial to that, this large muscle right here is the brachioradialis. So if you get this central area with the capitellum, trochlea, and brachialis, and you move radial, you'll find that radial nerve and the brachioradialis. The same thing if you move over more ulnar. You can find another muscle right in this area. This is going to be your pronator teres. Right next to that pronator teres is going to be your median nerve, your brachial artery, and your basilic vein. And so really with this home base, you can identify nearly every important structure of the anterior elbow. If I glide a little bit further distal, I go over the distal radio-ulnar and the distal humero-ulnar and humero-radial joints in the transverse plane, and then I come to the radial head right in this area, and I'm going to take my model's arm and I'm going to pronate it and supinate it, and you can see the radial head moving back and forth here. And if I move more ulnar, you can see right in this area, this is going to be the coronoid process. These are easier to see when I go back into long axis. So now I'm going to switch over to the long axis. I'm going to increase the depth here. I'm going to change the position of the focus. And I'm going to move more over to the radial aspect of the elbow. Proximal is going to be on the left of the screen, distal is going to be on the right of the screen. So I'm going to come right over the top of the capitellum. So right here is the capitellum. And just proximal to the capitellum, you can see this little dent right here with a little hyperechoic fatty tissue in this area. This is the radial fossa. So it is above the coronoid process. If I go a little bit distal, here's the radial head. So here is the radiocapitellar joint. So right in this area is one place that you could see an effusion, or it can be all the way up here in the radial. Or if I keep going down just a little bit, so there's that radial head, here's the radial neck, and here we get into the diaphysis. So right in this area, deep to the supinator muscle, is where the annular recess sits. And so this is a place that you can get fluid accumulation or you can have a loose body. Now if I come back up over the capitellum and I start gliding ulnarly, I get over the top of the trochlea. And if I come just proximal to the trochlea,
you can see this area here. This is the coronoid fossa, again, with a little periarticular fat pad. So it's actually intra-articular but extrasynovial. So fluid can accumulate deep to this fat pad, and so this is one of the areas where you can see a fat pad sign. You can also get loose bodies in this area. And it accommodates the coronoid process, which you can see right here is the proximal ulna. So we can also look at those fossae in an anatomic transverse plane. So right here in the center of the screen is the humerus. And as I glide distally, the humerus is going to start flattening out. And right here, this is going to be the coronoid fossa. If I come over here, this is the radial fossa. And if I go just a little bit further distal, then you have right here the capitellum, and right here the trochlea. So remember, the coronoid fossa is just proximal to the trochlea. So if I'm on the trochlea here and I go scan a little bit proximal, here's the coronoid fossa. If I come back distal and I'm over the trochlea and I move over the top of the capitellum and I move a little bit proximal, here's going to be that radial fossa. Okay, so here we are back at home base. So we've got right over here the capitellum, right over here the trochlea. Sitting on top of it is your brachialis. And as I said before, if you go over to the ulnar aspect, you've got your pronator teres, and here's your median nerve. And I'm going to set my focal zone so that it is up with the median nerve. I'm going to change it so it's a little bit less. And now I'm going to glide distally, and you can see right here the pronator teres coming over the top of the median nerve. So I'm continuing to follow the median nerve, and as I come distally, and I'm going to change my focal zone again. As I come distally, I'm going to look for a slip of muscle right here. See how there's this slip of muscle coming on the inferior surface right here. And that essentially is where the pronator teres ulnar head comes underneath the median nerve. And here you can see the ulnar artery. And so this slip of muscle that goes between the median nerve and the ulnar artery is going to be your ulnar head of the pronator teres, whereas this is all the humeral head of the pronator teres. So this is where pronator syndrome occurs, and it pinches the median nerve between the two heads of the pronator teres. So that's an important area of potential pathology that you need to remember. One other nerve that we need to scan is also the radial nerve. So I'm going to go back to home base. So here's the capitellum and the trochlea. Here's the brachialis. And I'm going to move more radial this time. And here you can see the radial nerve right here with the brachioradialis. Now as I glide distally, you're going to see the radial nerve. I'm going to just bring this back up here. So I'm going to just go up more proximally so that we get the radial nerve all together. So here's the radial nerve as one nerve. As I come down distally, you can see it separating into a superficial and a deep branch. And as I come down distally, this deep branch right here is going to pass right there underneath this slip. It's called the arcata froche, and that's the anterior proximal of the supinator muscle. And then it's going to go between the two bellies of the supinator, and it'll go all the way out to the posterior aspect of the forearm and innervate the posterior forearm musculature. Now, this is an important site of potential pathology as the deep branch of the radial nerve goes through the arcata froche. The superficial branch right here, that's going to stay superficial and to the supinator muscle, but deep to the brachioradialis, and you can follow it all the way down to the forearm. So now you've looked at the fossae, you've looked at all the different muscles, but we want to look at that biceps tendon a little bit more specifically. So I'm going to change my depth. I'm going to change my focal zone. So right up on top here, this is the biceps tendon. And I'm going to look at it in short axis, and I'm going to make sure that my model's forearm is in full supination. So that brings the radial tuberosity more into the volar aspect of the forearm. And as I glide distally, you're going to see that biceps tendon moving deep here. You have to really aim your transducer so that it's pointing more cephalad, because this is diving so deep. In order to eliminate anisotropy, you have to really point that transducer very cephalad. I'm going to keep gliding a little bit further proximally. You can see right here, there's that biceps tendon. And right here, it's attaching to the radial tuberosity. So I'll go up a little proximally. You can see the biceps tendon coming back up and out. And I'll just glide distally again. And right there, it's attaching to the radial tuberosity. You can look at that in the long axis as well. So I'm going to rotate so that proximal is going to be on the left of the screen and distal is going to be on the right of the screen. So let me get back over the top of that biceps tendon. Okay, so proximal will be on the left of the screen, distal will be on the right of the screen. The biceps tendon is superficial there. And I'm going to glide distally. You can see the biceps tendon coming down here. And right there, it's attaching essentially to the radial tuberosity. But you can see how it just kind of becomes a little bit of a mesh, and it's hard to see down in this area. And that's because you have, number one, you have your lacertus fibrosis, so everything's kind of spreading out a little bit, but also it's at a steep angle. And even when I dig the transducer down pretty significantly distally, and this is uncomfortable for your patient, I can't see the distal fibers that well, and of course this is where we want to look for pathology. So the other way of looking at that distal biceps tendon is through the pronator window. And so the way that I like doing the pronator window is bending the subject or the patient's elbow to 90 degrees. Proximal is going to be on the left of your screen. I'm going to move my transducer up into this area so that I am parallel to the humeral shaft, or in plane with the humeral shaft. So here is the medial epicondyle. Here's the humeral diaphysis. And I am going to start gliding the transducer distally. So look at the transducer and look at how I'm holding it. And as I glide distally, I'm also going to increase the depth here, and I'm going to change the position of my focal zone so it's deeper. So I'm going to be looking at deeper structures here. And I'm going to keep my eye out here right for that round structure. So I'm going to come back here. So here's the medial epicondyle. I'm gliding distally. And right there, that's the radial head. So you can see as I pronate and supinate the forearm, you can see the radial head rotating right there. Okay, so I'm going to keep my model in a supinated position, and I'm going to keep gliding distally. And I know that the biceps tendon attaches to the radius. So I know if I've got radius in the picture, I'm going to be able to see that biceps tendon. Now, one of the key anatomic landmarks that helps me find that biceps tendon is the brachial artery. So when the brachial artery comes into view, and right here you can see that brachial artery coming into view. I'm going to get it back into view here. So there's that brachial artery. Sitting deep to it right here is the biceps tendon. So I'm going to look at my transducer a little bit to get a little bit more of the biceps tendon. But here you can see this beautiful picture of the biceps tendon coming down and attaching to the radial tuberosity. And I can pronate and supinate the elbow looking at that biceps tendon. So this is a great way of determining if that biceps tendon either has tendinopathy or if it's intact. You know, frankly, this is how you're going to diagnose your rupture. It's a much better view than trying to do it from the anterior window. And that completes the anterior elbow examination.